Okay, back with another week of Podding with PT. I'm Tyler. I almost said Patrick. Damn.
And I'm Patrick.
And today we got a special guest, our good friend Marisa, coming over from Connecticut. Marisa used to come to our elliptica classes back in the day when we were back in Connecticut. So without further ado, if you want to give us a little bit of an intro.
Yeah. So I'm Marisa. I am a licensed professional counselor in Connecticut. I've done a majority of treatment with children, adolescents, and their families, mostly high-risk children who have a lot of trauma, depression, anxiety, and I've worked with them mostly with in-home settings as well as in a private practice setting. So I've been doing that since like 2014, 2015 now. I've been licensed since 2018. So it's been,
nice.
Yeah, it's been a nice like 10 years. So, with training and school and all that. So
what got you started with this kind of that avenue?
I was undergrad psych with a mental health concentration. At first I wanted to do teaching, but then just thinking of doing like classroom management with like a whole bunch of teenagers, and just like, I was just like, I don't think I'd be able to do that. So, I kind of just explored like other options that were still like looking for connections with kids. Like I always want to do something with kids. So I figured like, I can do, something with therapy and something that way. So I always knew I had to get my master's. And then I did internships with like domestic violence shelters. And then when I got into grad school is kind of when I found, like the private practice setting, but then also kind of like the crisis settings within the state, and kind of got my training there and all my experience, and I loved all my cases and all my families. So I just kind of stuck with it.
Going from like adults working with that domestic violence and then bridging into children.
Yeah. Sometimes adults are hard. Adults are kind of stuck in ways, and it takes a lot to get them to recognize, or get them into a stage where they want to change if they haven't recognized it yet. Where kids, they're either being forced into it, or they have a little bit of more insight into what's going on. Like they're not so set in ways where they're like, this necessarily isn't working for me. I'm losing friends. Like I'm not fitting in, or, there's something that's just not benefiting them. But then also the mental health part is not benefiting them. And they're like, I want to change. I can't keep doing this piece. So, that's kind of what I like better about working with kids. Adults, I just feel like they get so stuck. And it just sometimes is a cycle, and it just takes too long. So I'm just like, I can't sit here and do this anymore. But then it sucks because when you're working with kids, you have to work with parents. Like that side I kind of lost, but like at least parents, like most parents will care about their kids, and they're like, I want to see the best for them. And they'll take like your recommendations, and, the safety planning and all the things that you'll do with the clients. But again, that depends too. So.
Yeah. I'm not too well versed with like counseling and things like that. So like, how does it start? Like the whole process when starting to see like a child for one of their situations.
Yeah, so I think it depends on like what level of care. So like in my private practice setting, like a parent or a school or whomever will refer a child. So they'll just say, someone, this is what happened. Little Brittany, was having suicidal ideation. She came to the school guidance counselor. I told mom that she should come to you. And then they'll come in for an intake, and, each counselor kind of sets everything up differently, but I'll take both the parent and the child in and kind of get an idea of what's going on. And then meet, the parent individually and then the child individually, and just get an idea as to, what's been happening, if there's any history, if they've ever had treatment before, and then try and identify, some goals, from both of them, in the first session to see kind of, what they want and how they're going to achieve that. And if they have insight to that, sometimes they don't, sometimes they do. It really depends on the client.
Yeah.
So.
And I feel like, especially like, I don't know about you, but I feel like I need to go to therapy after like hearing so many other people's like issues, and how it starts off as like, oh, I'm coming into you with shoulder pain, but like you're with those people like 2-3 times a week for like months on end. So you start to get really close with them. And sometimes you hear a lot of things like history of abuse or trauma or things like that. And I'm like, damn, it kind of weighs heavy on me, because sometimes I'm there looking just to treat your shoulder. And then it was like, oh shit, I didn't know there was that many things that were involved in this. I'm like, damn, I think sometimes I need to go to therapy to kind of like work out those issues.
Yeah.
And that gets heavy.
Right. And for me, it's like, along with Tyler saying, it gets heavy. So it's like, how do you like kind of work with your emotions, your feelings, and how do you like, not take on everybody else's?
Well, it's definitely tiring. It's a lot. I don't know. I think, with training, they teach you, it's not being sympathetic, it's being empathetic, and just, you're connecting with them, and you can, try and understand, what they're going through, but you're not the one going through that. So even though I may feel very deeply and very saddened, or, whatever it may be about what's going on, like, just think about how they may feel and how much they've been carrying for so long. So even though that, like, I may, like, let's say I do take some of it home, like, and like, I just say I'm tired, I think it's just, I have to think of just how tired they may be. And then like, just trying to think of like what I can relieve for them in any way is how I try and do it. But then there are just some other days where I'm just like, like, I don't even know what to say.
This is not happening today.
Especially my other job, because it's so intense. Again, like, we're getting kids, like, with bipolar disorder, who have suicide attempts, substance use, with other disorders. It just gets that becomes a lot. So that you just kind of have to, like, turn off your phone. You really have to have good boundaries. Is this really a crisis? Does this need to be discussed right now? Because I'm a supervisor, can this wait for a supervision? Those types of things. It's really, boundary setting, and just making sure that, you're not letting too much creep into the life that you want to have, outside of your job. And really just trying to disconnect that way.
Gotcha. One of my questions, I think, for you is, especially with COVID and everyone being locked down, how did that relate to your, I guess, your population? Like, did you see more of the things like the bipolar and suicidal ideations?
We saw, so like, for my full time, with like the intensive in-home, in Connecticut, we saw an increase in depression, self-harm and suicidal ideation, suicide attempts, and eating disorders. So there was a comorbidity with, like, suicidal ideation, self-harm, and eating disorders among females. And then there was an increase in males being hospitalized, but there was an increase of hospitalizations among the state. So there is like a state crisis right now in Connecticut, where there are no inpatient beds available for children or adolescents. It takes forever for them to get admitted. And if kids need like a higher level of care, where they need to be almost like in a locked hospital facility, which I think there's only one in Connecticut, it's taking months for them to be admitted there. So they need to stay in like Yale, Bridgeport Hospital, St. Vincent's, like all the other smaller inpatient units for months at a time, which isn't allowing the kids who are having like their first or second attempt, or, inpatient, eval, they can't get on a unit because there's still so many kids waiting to go to another level of care. So the whole mental health system in Connecticut right now is just, it's overloaded with kids, and the need for all levels of mental health service. It's really sad. So
for those kids that aren't able to go into inpatient system, is there any like at-home care or things that?
Yeah, so like so my program will do that. So the intensive in-home, it's called ICAP. So it's intensive in-home child adolescent psychiatric service. And again, it's an in-home service. But then if a kid is unsafe where they need to go to a hospital, or they're going multiple times and they're identified as needing that level of care, you can't drop down another level because you're identified as, needing a hospitalization. You're not, community level of care at that point. So then you need to be elsewhere. But there's just a huge mental health crisis. Like I just think because of COVID now though too. But that's why I opened up that's why I did private practice work during when I moved back here to Middletown, because there is just an influx of clients. I can have a client, an intake 2-3 every day if I wanted to. Like that's how many people are in need of services right now. It's sad. It's nice, to have that, as a a business outlook, right? You'll always have a client, but it's sad that so many people are having so many different types of issues. And I think it's really sad to just see that people don't have access to the levels of care that they need, and they don't know what to do. That's also the sad part.
Yeah, I'm curious about the patients that you see that go into the hospital but aren't getting that quality care like in the unit that they need. How are they kind of playing a role? Because when I had my clinical in the hospital, when I didn't like see the sun, didn't get fresh air, all that stuff, it dropped my mood down like a whole bunch. So I'm wondering if you already have that dilemma and now you're in the hospital but you're not getting treated necessarily for the stuff that you need. Like how are they kind of faring with that?
That's a very good question, because I have no idea. Yeah. I can only imagine that it probably just makes it worse, just trying to wait and see and wait things out and just figuring out where they're going to go. But I just feel like COVID just kept everybody isolated, and like and then trying to come out of that was just like a huge transition, especially for kids. Again, like just being cooped up in their home and being on their computers, which is something that they're used to. So in trying to come out of that and then having like all of these other things and social media and just all of that, it's just, there's so many factors that come into all these mental health issues now. And then on top of all that, whatever was going on before COVID, family wise, all that stuff, there's so many factors in mental health, which I think just makes it so hard too. It's not just like one thing that you're focusing on at a time. It's, a lot of multiple things that you need to look at to kind of conceptualize, the client or your patient, and then, coming up with a plan from there.
I thought it was pretty interesting. Also, a lot of like my patients that have kids will talk about the social aspect that COVID took away from them. So a lot of their kids only know COVID. So they know that if somebody's near them, that they should probably stay away because they might have COVID, or like not even seeing the facial expressions or knowing how to react because you have a mask on, or like your friends have masks on. So can you touch a little bit upon how that has to deal with mental health?
Yeah. I mean, just think of like the lifespan, right? And like developmental wise. So you think of a baby, someone had a baby during COVID, that baby didn't get the socialization that it would if it wasn't COVID. So they're not seeing anybody other than their parents. They're not playing with other kids. Play is huge in developmental stages, and learning how to socialize, learning how to attach to other, members other than, your caregiver or your parents. So that was a huge thing during COVID. But then you look at preschool age kids who had never been to school, who were prepping to go to school, who then had to stay home because of COVID. Again, they don't learn the social skills. They don't learn the emotional, some of the emotional intelligence that they're going to have to build, to deal with, impulse control, like anger management, sharing, just like some of those simple things that they didn't learn. Now so one that would learn in preschool, so they had 2 years at home. So that brings them into first, second grade. And you think of a first and second grader learning how to share, impulse control, and all of those other things. And then probably being, behind in grade level, getting frustrated. And I don't understand, what's going on at a second grade level. again, there's so many different pieces that come together because of COVID now. And then if you think like you guys went to school at Sacred Heart, so I'm sure like some people, you know, working in Bridgeport in the hospitals, again, like, so that economic status and that lower level, you know, inner city school that doesn't have a lot of you know, supports or resources, you know, kids are just being, you know, they're being passed on. They don't get recognized, or you know, they're not being dealt with. It's not, you know, being looked at, or it's not as important as, you know, some of the other issues that are happening within the classroom, or things like that. So it's again, it's just like a trickle effect that just kind of, you know, affects everything.
Right. What comes to mind is like when we were learning about pediatric milestones and that
Yeah.
that shared play. So or
Yeah.
kids playing with the same building blocks, and then they have to share the building blocks, and then on the other side of that, they have their own space and their own blocks, and there's
Mm-hmm.
kids with their own things and being just in the same environment, but
Yeah.
isolated play. And
Mm-hmm.
so it's just like all those things that they're just not being exposed to. It's a lot. It's a lot. So
Yeah, but then like you think of, again, so like you think of an adult who's probably learned, or at least learned some skills to deal with stress and transitions and all of that. You know, some of these kids have never, they were never given that opportunity to do that. And then maybe the parents, you know, haven't, they don't know how to teach their child that, or they would learn it in a school to start learning some of like those smaller skills. And again, it's just missed. So again, like that's kind of, you know, where like, you know, some of my role would come in an outpatient. You know, if someone has picked up on that at school, or a parent is like, hey, like, you know, something's going on, then they would come to me and they would help kind of learn like those, you know, those skills to kind of help them through the transition, or to kind of just help them kind of manage, you know, the emotions or whatever's coming up for them, you know, from whatever it is that they didn't learn, or, you know, whatever is frustrating to them, or, you know, whatever it may be.
is there
So
a particular age range that you see?
I like to do, I see kids like 5 and above. I don't like to go over like 35 years old. I do anything 35 and below, 5 and above.
Okay. So
Oh.
you kind of talked on like different techniques to learn these things. What are those things that you kind of go through?
So I mean, like, like you have, we talked, you know, I saw that you posted like the tapping. So, but tapping pulls a lot from cognitive behavioral therapy, which is a lot of what I'll do within like my treatment. So it's, you know, being insightful to emotions, behaviors, um, and then trying to reframe like the thoughts that you're having kind of around like what all of, you know, your thoughts, your behaviors and your emotions all kind of influence each other. So it's kind of reframing your thought process to then change behaviors and emotions around that. And then, you know, how do we better deal with that? What are the skills that you can utilize? How do you catch yourself in the moment? And then just some of like the smaller techniques that everyone needs to, you know, to learn. So if that's deep breathing, if that's mindfulness, if that's you know, just smaller coping skills, you know, walk away during an argument, just say you need some space, you know, things like that. Like it's just reminding kids, you know, that these are some of the things that you're going to have to learn, because some of these situations are going to happen again, like throughout your lifespan. And it's just like, how are you going to better manage them as they continue to get more intense and worse as you get older, because you know that those are the reality of things, is that, you know, some of these things just don't change and they get worse as you get older. It's just, how are you going to be able to deal with them?
Mhm.
Right. Before we go a little deeper into that, Tyler, can you give a little background on the tapping?
Yeah. So the book that I've been kind of going through is called The Tapping Solution. And I know you could probably touch on that pretty good, Marissa.
Mm-hmm.
It pretty much is there these acupuncture points that you press or that you tap on,
Yep.
and you pick an emotion or you pick like a goal that you want to go through. So say if it's pain or stress, you acknowledge like, okay, even though I may have stress in my life, I still accept myself for it, or it's like I give like a positive affirmation. So you go through
Yep.
these tapping points, and there's like series. So like the first round is just acknowledging that you have that. Then the second one brings upon that negative emotion to, so while you're tapping on these certain points, then you're saying the negative emotion. And then when you say the negative emotion, you feel like it's finally not giving you that same scenario, that same energy in your body. Then you end it with like a positive one. And
Yep.
so now you're changing. So you're acknowledging it first, then you're making light that it's negative, and then you reaffirm it with a positive. And one of the things that they kind of talk about is like they always make you rate your intensity.
Yep. The intensity level of the unit. Yep. The
Yeah.
subjective units of distress. Yeah.
Yep. So it was like whether it's when you start, like say you think of a thing like a test that you're studying for. So you think of the test and you see how much it charges you emotionally, and you rate it on a level. You go through the tapping, then you go like a test retest towards the end.
Yeah.
I just started. Tyler told me about it maybe a week or two ago.
Yeah.
At first, I was hesitant just because I hate the sensation of being tapped. And I don't like other people tapping on me, and I would rather not tap on myself.
Yeah.
So it's like if I can, because I also in the past couple months been using the calm meditation and meditations and things of that, and I was like, if I can meditate without like tapping on myself, I think I'm pretty okay. But I did go through one of their guided meditations with the tapping, and I felt like it did help. And initially it was like annoying to go through the tap and just like different ways, but I eventually like calmed down, and it actually felt really good.
Some of the evidence that like I was reading, because I wanted to see, so when I was introduced to the EFT tapping, or it's an emotional freedom technique. That's what it's called. And I was introduced to it. It was like 2000. I think I started my grad school in 2013. So 2013, 2014. And I don't think it was evidence-based at that point. So they were still doing like a lot of studies like behind it. But it was showing that people were obviously very like moved with it, and that, they can obviously some type of change like after the tapping point, but they couldn't figure out kind of like what it was doing to the body. They can just say like, obviously like the intensity went down. But then I think what I was reading, when I did like some other research outside, is that they found that there was a lot of decrease in I'm probably going to say it wrong, cortisol,
Yep,
in the body. And then, so there's been a lot more studies on that. And then I think, again, they've done so many more studies to try and make it like an evidence-based practice. And then they've been using it in different, not just for like stress, but they use it for weight loss. They use it for pain. They use it for anxiety, PTSD. So I've seen it used. They've used it in a lot of different, with different diagnoses and different, situations. I've seen it, in the research that they've done. So
yeah.
it's
Quick
really
question. So a good friend of mine does teaching, and he's up by, I think so. He's from Oxford. I don't remember exactly where he teaches now, but he said that he was doing during his like clinical for teaching wise, he did Sandy Hook High School, or like in the high school area, and he was like, at this time in my career, I'm working with the kids that were involved with the Sandy Hook shooting. So like you were talking about before, kind of with COVID, is like a lot of these kids had been able to, in a sense, act inappropriately in school, and people let them slide because of the trauma that they had kind of talked about. And he's like, I'm getting a lot of these kids now, and they don't know how to act in a high school setting, or don't know that they should be putting in forth more effort in certain things because of all the trauma, and people kind of let it slide. And I know that you said that you worked on the tapping after the Sandy Hook. So
like that, it was introduced after Sandy Hook, again, because I know that they have a tapping for Sandy Hook. And again, they do a lot in his book. They talk about like how you can utilize it with trauma, and just how like, again, like trauma is kept like within the body, and how the tapping can help release that. But then, when you were talking about kind of just like the steps that you need to come through, there's just so much, at least with PTSD and like trauma, like when you really talk about that, I feel like there's always so much prep work that needs to go in, before doing something like this, just because, like after you've gone through kind of like the whole step process, you've identified like the main problem, or like the most pressing issue, I think is what they call it. They've identified the intensity, you've done the whole tapping, you've done the final breath, but they can still reprocess some of the trauma with whatever like they've identified. So then that can affect them like outside. So then if like if they're triggered, like let's say if we're going to use the example of school, like where your friend, they're acting out or doing whatever. So if they're doing something like this with me, like an outpatient, and they continue to reprocess their trauma, even if they recognize it or don't, that can come out in, acting out behaviors, whatever their triggers may be. And then, and just kind of doing whatever from there. So again, I think just there's so much prep work that needs to go in with trauma. And that comes in with like the other modalities that I use. So like CBT has a lot of prep work. EMDR, which also is very similar to tapping. It's like the eye movement desensitization technique. Again, which kind of does like the same thing. It's like that mind body, but gets someone like so relaxed to kind of just reprocess through trauma. That takes like a lot of pre-prep work just to try and work through that. So
can you go through that?
Before you go through that, can you just give me your definition of like what trauma is? Or just like, how would you like define it? Like, everybody has like a different definition, and so just trying.
But that's the thing. I think everybody has a different experience of trauma, right? So like me and you can go through like something that's identified as trauma, but you may not identify it as that, and I may, right? But the way that we're taught is that sometimes there's a big T and a little t. So a big T is like one that someone experiences. So if that's, something like Sandy Hook, right? Like you are straight in there, you were involved, sexual assault, domestic violence. I'm just trying to think of, some of the other ones that are listed under the PTSD diagnosis. But it's literally having that experience, a near-death experience, something like that. That's listed as like a big T. Then there's like these little T's where sometimes they'll happen over time. So if that's living in like an unsafe community, you think of Bridgeport, that's growing up, in PT, that's growing up in the Greens and being exposed to community violence and shootings, but never necessarily experiencing, those things yourself, but always being on high alert to knowing that I need to keep myself safe. And these are the things that I do. So those are the little T's of, of that. Or, you can look at those as life transitions. So sometimes if that's a divorce, if that is, sometimes people can even look at like, if it's buying or selling, a house, like those things can be like those little T's where they may not look, as traumatizing as someone outside. Well, if you're buying a house, well, all like the other steps that are behind that are very stressful and can be very traumatizing, to someone to try and get all those things together. And what does that look like, and how, and, all of those, the smaller things that kind of lead up to the big thing, I guess is what I can say. So, but technically it's being in the experience yourself.
I heard it described as any experience that makes you change the way you view a situation can be labeled as a trauma. So
any experience that changes your view of the world is a good way to put it too.
So yeah, if it's one major T, or multiple little small T's, it's anything that just changes. And so
yeah,
I feel like people, or particularly myself, is like I don't recognize like all the small T's and or honestly even like the big T's, because I was talking to Tyler, like I feel like I don't remember my my past a lot. I feel like talking to other people, they remember ages. I was like, oh, I remember when I was 6 and I was doing that. And I was just like, you think about that? Yeah. Like you just remember that? And I was like, okay, maybe I need to talk a little bit more, just like try to figure out like what's going on.
One thing that, again, so like tapping that the book talks about, or what they reference, is something called the ACE study. So the adverse childhood experiences. So, and this can probably relate to something for you guys in PT though, too. So those who experience more traumatic experiences as a child under the age of 18, as they get older, will experience more physical and emotional like damage almost. So they'll be more prone to issues like like pain management issues, depression. They're more prone to having a suicide attempt, more prone to like high blood pressure, diabetes, and all of kind of like those things that can be related to stress, but then they relate it to experiencing trauma, which then causes the stress, the stress response, right? You're constantly keeping yourself in that hyper vigilant state to keep yourself safe, or whatever it may be. Again, to just keep yourself within that normal, or feeling within that normal state based off of whatever trauma you've experienced.
I think that has a lot to do with um, we we see patients with chronic pain.
Yep.
And so what that is typically characteristic is the body has a natural healing time frame, and then
Yep.
the pain goes way further than, so the tissues are healed, but your body still experiences that pain with either different emotions, different stresses, creates a pain within the body, even though the actual tissues of the body has healed.
Yeah. Mm-hmm.
That's
It's
what I think. Yeah, that's huge. Even going over like the tapping stuff,
yeah.
like learning to bring those things up. I think one of my things, so kind of what you were talking about, Pat, I feel like as I've brought up more emotions from my past, I've started to feel more pain in my body. Whereas like when we moved at first, so I moved and I feel like I've changed my mindset a lot to the point
Mm-hmm.
where like the person that I was before I moved is not entirely different, but pretty different than who I am now. And I feel like I
Yeah.
don't remember anything from my past at all. It was like from a year ago before, I don't remember. And
Mm-hmm.
as I've kind of like sat with more emotions or sat with more things, I started to feel more aches and pains in my body. And I don't know if that's like kind of showing itself a bit to be like, hey, like this is an energy or this is a trauma that's coming up, whether it's a big T or a little T.
Mm-hmm. It could be. But then it's just, then how, I think my question is just how would you guys, again, because I'm sure it's probably mostly pain that you guys would see, correct? So then it's just, then if you wanted to use like a technique like this, it's just like, how would you have people like buy into something like that, or at least trying to recognize that there is an emotional, or like like psychiatric piece behind pain, and that you can utilize something like this to try and change that.
I always tell them first, like I am not a therapist in that sense. Like I don't have the training for that. So, but what I can at least do is show them like how your body's response to pain. So say like you're always stressed at work. It's going to change the way you think, change the way you breathe, and now put you in that like kind of like we said, that fight or flight or that hyper vigilant. So I
Right.
kind of equate it to it's like you stepping on the brake and the gas in your car at the same time and always
Yeah.
going. So it's like that's going to cause fatigue or cause stress or cause things to have to pick up more than what they should or doing what they're not supposed to do. So I kind of highlight in terms of like how it reacts with your body. So maybe it's like your diaphragm or your low back, or that's why your low back feels chronically tight. So I
Yeah.
highlight it in that sense. And then I always give them books to read. I'm like, and it kind of shows me whether or not you're really serious about your health. Because if I give you a book
Yes.
to read and you don't read it, it was like, that's on you. So that's
Yeah.
kind of what I do. And if you want to go further into it, then shit, ask me questions. Ask me if I know anything else. So that's kind of how I do it.
Mm-hmm.
And for me, I kind of go, if I'm thinking more chronic pain, I kind of go through describing how pain is experienced in the body.
Yeah.
Meaning that sometimes with the chronic pain, the tissues have healed, but your body is on. I use the analogy of pain is like an alarm system.
Mm-hmm.
Like a car alarm. And so imagine if your car gets hit by a rock and the alarm system goes off. Yes, you had a trauma, you had something happen, and then there's a response. But sometimes that alarm system is highly sensitive.
Yeah.
Usually it goes up, and the your sensitivity to pain goes up in the presence of a trauma, and then
Yeah.
as the tissues heal, the
It will
sensitivity should decrease.
decrease.
But if for whatever reason you're you have a high pain sensitivity, it's you have to be able to recognize that and realize that the move. So if, for example, someone sprained their ankle, like now, though you have pain in your ankle, you don't want to avoid it. You want to walk, because avoiding it is not going to make your ankle better, because
Yeah.
you're not using the muscles, and you're going to, and now there's a fear along with using the muscles. And so it's like you
Right.
have to teach yourself and trust yourself to, even though that they may be of pain, that you're not in any trouble of harming yourself.
Yeah. That's something. So like the tapping piece, like people, so like, at least for me, like, especially if it's tapping, if it's like cognitive behavioral therapy, the CBT, people are always like, oh, like, why are we starting with the negative? Like, why do I have to start with like my negative thought? Why is it always the negative? Well, the negative is kind of like what you came in for. So if we can work on the negative and kind of and identify that and work through that, then we can, we can push through and reframe, towards the positive. And what is that going to look like? So when we can identify and have insight to and tap through, or change, whatever it is the negative is about, then we can work, and change towards the positive piece, or have that more positive mindset on whatever it is that was negative. That's a lot what tapping does. And again, I think CBT kind of does like the same thing, where it's like that automatic negative thought that we have, and then we change it to a more positive automatic thought that we can have within the same situation, within the behavior, whatever it is. And then tapping does the same thing. So when the main issue comes up, we have, instead of having that first negative, thought process, I can't do this is, I'm sad, whatever it is. Well, even though I was sad, I'm still able to get through that. So then they could, at some point throughout tapping, you do end up taking away that first, like, they have a phrase for it. I forgot what it is. It's like the identifying thought, or the identifying phrase, and then the phrase after it has a name. I'm trying to think. The statement, like it's a setup statement, is like the second part. So I think that's kind of like where you want to end up, and that's kind of like the ideal frame. So it's just like, and then it's tapping through that to get your body to kind of accept that. So
I think that's pretty important that you talked about the bringing out the negative. One of the things that they said in the book that kind of hit close to home, because I'm been so much on like the positive affirmations, or like, okay, make sure I highlight the positive. They're like, imagine you have a garden and there's weeds in the garden. You can say all day long that the garden looks beautiful, but there's still weeds in the garden. And until you deal with the weeds, you won't be able to enjoy the garden. So I was like, I feel like with patience, it's important to, I guess, identify like, hey, yes, right now there's a limitation that you have, but because you have this limitation, let's see if we can find other branches. So kind of, I know you said a couple of times, it was like, okay, maybe you can't run 10 miles now, but maybe let's see, maybe you might like biking or rowing or something like that. So it was like reframing their mind to say, okay, even though I can't do this right now, I can still do so and so. So you're not completely ignoring their, oh shit, I can't run 10 miles, but it's like, now let's give you a different avenue.
Yeah.
Or also on the flip side, like we're running 10 miles, had an injury, and you couldn't run at all. But after a couple of weeks, now you're able to run 2 miles. Like, being able to be aware and recognize that you are making progress, though you're not at where you want to be. That's from a couple of weeks ago, you weren't running at all, and to now running 2 miles is a big accomplishment, and you should be able to recognize and just be aware that
Yeah.
you're making improvements.
Yeah. See, for you guys, I feel like it's nice because you have something physical kind of in front of you to show that you have made progress. You know what I mean? Whereas in like mental health, like I can like we can identify a goal, right? For a client. And I can look at like, okay, well, we can look at the intensity and the duration of something. And if yes, we can look and see if that's decreased, but if they're still feeling something along that, even though I can see a decrease and they don't have insight to that, it's sometimes it's just so hard having them recognize some of that progress that they made because it's not like right there in front of them, and like it's not seeable. Like I don't know like how else to phrase it, you know what I mean? And I think that's just kind of like um you know, sometimes like what we run into, and just really trying to motivate, at least for me, like trying to motivate kids and teenagers to just keep going. As you know, it's not just like one thing that we're doing, you know, it's you know, trial and error always, but it's also being consistent with things and trying to figure out like what's going to work for you and what's not. But sometimes I know that that's like a huge struggle within mental health, just because it's like you can't see it all the time. You know, you can't see your progress.
Yeah, can you go over what exactly cognitive behavioral therapy is, or like a quick and dirty definition of it, and how you practice?
Yeah, so cognitive behavioral therapy is it's an evidence-based model of therapy. It's kind of like the golden standard, what a lot of people will utilize. So it really focuses on how thoughts, behaviors, and emotions kind of all influence each other. So like how I think will influence how I behave, and then how I behave will influence how I kind of feel, and kind of looking at all of those things. So then most people will come in around, like I use this a lot with like anxiety and depression with kids. So for example, you know, I'm not good enough, you know, I can't get over this, there's nothing that I can do. You know, kind of all of those negative thoughts that come along with like anxiety, high stress situations, depression, I'm never going to get better. So when they come in and they say those types of statements, okay, well, let's check that for a second, you know, and let's break that down. You know what? So you break down the automatic negative thoughts that they'll have. What situations bring up those negative thoughts? How do you behave in that situation? What emotion you feel? And then kind of you would go through, what facts do you have behind that statement to make it true, or that thought? So like, you know, I'm such a horrible person. Well, what facts do you actually have behind that you're a horrible person? And, you know, having them identify, well, you know, well, this happened. Okay. So maybe that's like one thing that would prove that maybe you're a really bad person. But then, you know, what are some of the other things that maybe show that you're not? And having them kind of be insightful and identify that, okay, well, this thought really is not serving me and it's not true. So then how can I reframe that? And really working them through all of those negative thoughts, which then hopefully would get them kind of to that core belief, or that, oh my God, what did we reference before? Kind of, you know, how people view the world, right? If we're looking at trauma, sometimes people will have a negative core belief about themselves that they've had for like such a long time. So by being able to go through those smaller negative automatic thoughts that we have, and recognizing them, journaling them, you know, being self-aware of when they come up, and challenging them outside by utilizing the skills learned within my, you know, the sessions that I do with them, then, you know, hopefully we can come to the core belief to then help resolve that and change that to a more positive outlook as well. But it's really looking at all those things together.
I was like, damn, every time I've thought negatively, I was like, do I have any facts to back that up? I was like, I really don't. Oh, shit. That's good.
Well, for me, is like when I have like negative thoughts, especially in the past couple of weeks, I'm like, why am I thinking like this? I was like, why? Like I kind of do that. Like I question myself, and I figured out like, where's this coming from? It's like,
Mm-hmm. But the tapping, even though some, like, there are other skills that the tapping does have that the book doesn't go over, that has people try and recognize that, like, the tapping does pull from other, like, modalities of treatment that have been along for a long time. But again, like, I think the biggest thing that the tapping pulls away from is having kind of like that, again, that the automatic negative thought that you may have about yourself, and then how can you change that statement and reframing that, and then again tapping through that, and then how does it make you feel at the end. So they can be interchangeable, and trying to use different modalities to get people to feel better is kind of like what therapists kind of have to do. Not one thing and one modality is going to work for every patient. So you have to have a toolbox of things to use. And you have to make it sound good for kids and all that too. So
especially for the people that, like, kind of like you said, was like, I don't want to tap, that feels weird. It was like, I even did it out in public before, and I was like, I feel kind of like people are staring at me. And then I got back to that, why I was like, why do I care that people are staring at me tapping? But one of the things that I noticed when moving here, there's a lot of mental health. I would say, like, that's a pretty big problem here. And the patients that I see, it's like a very big, like, anxiety, depression, in my patient population. Kind of what you talked about is like how you view the world. And it was like, here, it's damn near perfect. It was like, there's not really much that you can complain about. And I don't know if that drives onto the mental health aspect, or you see people with all these luxury cars or big houses and you kind of always compare yourself.
yeah, I mean, you could. I mean, if you look at Fairfield County, you know what I mean? And like, some of the clients that when I was in Fairfield County, and just looking at their kids, sometimes people just lack insight. They don't think that it's an issue. They won't identify it as that. Do you know what I mean? And they just kind of blow it over. It's not that. It always contributes to something else. They don't want to call it mental health. It's always a stigma around that.
Yeah.
But you see that everywhere.
I do want to kind of pivot to, if someone was having issues with creating their own boundaries, what advice would you give them?
Like, what do you mean? Like with
either friends or family, they feel like they're getting taken advantage of.
Yeah.
And just like, how would you start to kind of work with them, and or any advice you would give them?
Yeah, I mean, I think it really depends on, what type of boundaries, do they want to set, and why, and what is the goal around the boundaries. And I think looking, a lot of my work, especially with kids, right? Like, they want to be, friend pleasers. They want to, they want to impress their friends. They want to do all of these things. They may do, risky behaviors, drinking, smoking, all of those things to try and fit in, but it's not good. So you can still set boundaries while still keeping friends. But the reality of things is that you may not keep those friends as well. So I think with anybody, if you want to set boundaries, it's just recognizing the reality of things, and kind of, what are the outcomes if you do set that boundary? What can it look like? What may happen? And really, would you be okay with that outcome, at the end? And really just having people explore what that would look like, if they were to keep that person, if they weren't to keep that person, if that person was to leave. And again, how they would continue to be consistent with those boundaries. Because, sometimes when people set boundaries, people want to try and tear those down too, right? They want to test that. They want to see, is there a way for me to get in? Is there a way for me to just kind of, is the door still open for me? Can I get in there? And, how are you just going to be like, no, it's shut. Like, how are you going to be able to reinforce that? And again, it's being able to explore that and see what insight, the client has to themselves, but then also, what is it that they want out of that? And are they going to be able to hold to that? Is probably where I would start. Yeah.
I think another question, kind of going off of what you're saying, even just relationships. So, like, whether it's like the actual love relationship, or if it's family or friends or things like that, I started to think like, okay, how many of my relationships are more based on superficial things? So I tried to go, okay, what questions do I want to know in like the boundary sense? Like, okay, what do I want to have in a friend or in a relationship? And then I had such a hard time even coming up with any questions. So I was like, do you have any, like when you first start working with a kid, it's like, hey, I want to get to know myself. Like, do you have any set questions where you're like, all right, make sure you can answer these questions by the next session?
I think so. Like when people talk, and I'm going to recommend a book to you just for like, if you're going to think about like relationships and like things like that. So, and it could be friends wise, romantic wise, whatever. But, people can always identify like, oh, well, I want them to be like, I want to have like great communication and I want to have trust and I want this. And I'm like, great. Those are all great things that relationships are supposed to have. Wow, you can identify those. Okay, so what does that look like? What is good communication? What is good communication? What would you want out of good communication? What does that look like? Do you want someone to text you all day? Do you want like what do you want? But like it's but what is it that you would want and what would kind of put you over the edge? What would you not want out of good communication? And what is trust? How would trust be broken? How can trust be re-earned? You know, how can you show that you trust somebody? How can they show that they've earned your trust? Like different things like that is kind of how I have people dig deeper than just identifying, again, like those top superficial pieces, you know, because everybody can label the superficial pieces of what things are supposed to look like. But then when it gets deeper into, you know, all of those things, if again, what I always tell people, if you don't know what you want out of that relationship, that friendship, you know, that family member, whatever, then when something goes wrong, you're not going to know what's wrong. And when it's good, you're not going to know when it's good. So it's being able to kind of identify those things, you know, that you want, what they're going to look like, and noticing when they change, and then being able to make a decision for when they change. Well, do I want to keep this? Do I not want to keep this? Am I going to kind of bend on something, you know, and being able to identify why and why not.
No,
So
that's huge. Have you heard of the book Start With Why?
I think so.
Oh, yeah,
Have you heard of the book
recommended.
Attached? Because it looks a lot on all of those things too, like attachment styles within relationships and how to look at things. That's the book I'm going to recommend.
What was the book that
Attached?
Attached. Okay. Well, Start With Why. It kind of comes from more of a business kind of standpoint, and just like if you're looking to start a business, it's like, all right, what is your why? And so people are able to connect with why are you doing something more than like what it is that you're trying to sell. And so trying to have a clear picture of what you want, and then have things that you do follow that same thing. So I think it relates just because it's like, all right, what do you want? You want good communication, but what are you doing to achieve it? And then like, is that clear? Is that what you want?
Yeah, I think people also need to just recognize like the value of themselves. I'm sorry, like the value within themselves first, because if you don't value yourself, and then again, like value comes from like what you're going to identify, you know, as valuable. So if those things are valuable to you, then you're not going to, you know, fluctuate on what you want, you know? So then again, so if those are very clear cut to somebody else, then you're not going to move on that. And that's going to be it's going to be very, you know, in your face, you know, once you know that. So
I think that's a big problem that I had too. And even still, like small things, like whether it was business wise, where I would talk with Pat, like, hey, does this price sound good to you if I were to charge somebody this for a session? And he was like, listen, your biggest critique. It was like, you know what you don't do well, but other people don't know that. So it was like putting that value out there and just saying, hey, whoever I have that's going to be a person that values me doesn't care what the price is, because they
exactly
with. So it was like, for me, that kind of hit a little closer to home. It was like, I realize in a lot of things I don't value myself as much as I should.
Yeah.
Now trying to take those things, okay, so why don't I value? Is like, do you have anything else that you kind of look at, like, hey, look at these things in your life and see, like, all right, here's the value that I have in here. Here's where I do things well.
Oh.
That's a tough question.
I mean, I always, so like something that I like recommend for what I've been seeing a lot, like within like my older, like 18 and over cases, again, like is just being able to recognize what they want, and like just using, I have them use like their notes folder and like make notes as to like when they've, again, like almost like keeping a journal, like when did you allow somebody to do something that you didn't want, right? Or kind of take advantage or do this or do that. And again, utilizing some of the skills. So then how did that make you feel? And what is the thought that came along with that? And kind of working through all of those things with them. And then, well, okay, so if you didn't fluctuate on that, what would it look like? And how do you think you would have felt? And, you know, do you think you would have had a different outcome? So I think it's kind of utilizing those things with them. But I think, you know, having people identify like their own value, self-worth, like if that's what we want to call it, like takes time, you know, that takes a lot of time and confidence and work. And sometimes people can't, sometimes they can't see that, you know, and it's sometimes it's really sad to see that, you know, during sessions and trying to push them to have them to see that. But then when they do, it's so rewarding to kind of just have them come and say, hey, I made a decision for myself, you know, this is the outcome that I had, you know, let's talk about this, you know, maybe I can do this next time. So those pieces are very rewarding. But you know, what's very hard is when someone can't, and you know, they're the only ones that are keeping themselves from doing that.
Yeah.
So
I'm interested to know like how you kind of view goals for your patients, because from my standpoint, someone's like, I can't throw a baseball. It's I they have like a rotator cuff tear, and it's like my only goal is just to be able to throw a baseball with my son at the whenever we go to the baseball games and during the pregame or the tailgates. And so in my head is like I have this vision of how a throw is supposed to look and
yeah.
like that, and then I feel like we're only like halfway through the section or halfway through the rehab, and it's looking better, but it just looks off. And then
Mm-hmm.
it's like I'm able, like I think I'm done because like I'm at where I was before, and I was like,
Right.
and so that whole mindset, like I have this vision of what the end goal should be, and there was like, oh, I'm at the place where I already was, like I'm already feeling better, and and so just like working with patients and trying to imagine their goal, and I feel like
Yeah.
maybe
Yeah.
easier for you because it's like they are, well, in the sense that they are coming to you and like they are telling you their goals, and I don't know.
Kind of, because sometimes, so like again, sometimes people won't know exactly what their goals are. So like sometimes people are like so motivated for treatment and they've tried everything, nothing works. So they know, like, you know, I want to relieve my anxiety. Okay. So then like my job is to identify, okay, well, what's the intensity of it? How long has it been happening for? And how often does it happen? So then I want to decrease all of those things. Right. So that's kind of how I would look at it, but they may not look at it in the same way that I do. Right. So I think it's just having them recognize kind of what I need to do, like within my job, and then what it's going to look like for them. And again, that just comes through like the smaller objective goals. So yes, we want to reduce your anxiety. So then how are you going to do that? You know, what are the things that you feel that you can learn to help reduce that? And that's kind of when they're like, well, I don't really know because nothing's been working. So then I can educate them as kind of, you know, what's going on, yeah, or you know what they need to do. So if that's usually like, again, like teaching them skills, you know, self-worth, you know, work, mindfulness, whatever, deep breathing, all those things to help reduce anxiety, see if it decreases, things like that. But then, like, let's say, for example, in my other job, kids will get therapy and med management at the same time. And so when they get med management, sometimes meds will help relieve a lot of symptoms right away. And they'll be like, oh my God, I'm cured. It's like, well, no, not. Like, the meds help you get to a baseline where you're able to use these skills. So then if you get removed from meds, like, you'll be, you can try and learn these things now. So then it's like, well, then they're like, no, well, now I don't need to take my meds. And I'm just like, wait, what? You just said your meds were your meds, like, they made you feel so much better. Now we're going to stop them. I said, what happens if they make you feel worse? Because now you're not taking them. Then what are you going to do? So again, it's really just challenging people as to, like, well, what are you going to do if this really doesn't work? and really trying to, again, recognize the value within everything that they do have to do to get there, and why, and everything as to, what the purpose is behind that, and really just trying to see, well, even so, again, like, yes, you've met like halfway through, like, how you have to throw this baseball, but you can probably do it better. Wouldn't you want to do it better?
And probably the way that you were throwing it is why you're here in the first
getting
place.
hurt.
I was like, you probably didn't have that range of motion, and it just. But it's like, it's tough because, like,
I would be
so
that
happy,
type of
like, to
patient.
this point. And I was like, oh, I'm back, and I was like,
it still looks like shit.
I was like, oh, I'm back, and I was like. I'm happy with the progress that you made, and I'm glad to hear. But there's some work to be done so we can avoid this being a reoccurring thing.
Exactly. I know.
No,
I was just gonna say, it's just really hard. Like, when people see progress or they don't, it's just really hard to keep people to see. It's a skill on our part as providers to have people see the value in your work, to have them continue to come and to get better, or to continue to add on whatever it is that they've already improved upon, and just to have them see that value is, like, the most important piece of, like, all the work that we do, regardless of what it is. So
my question for you is, do you discharge patients? Like, is it they come through a full plan of care and you get to a point where they feel good enough to, okay. Yeah. So one of the things that I really struggle with is, one, even making sure patients know. I feel like a lot of times they think, okay, I have this shoulder pain. I'm coming into you. Once my shoulder pain is gone, I can be discharged. Whereas and then they think that they never have to do those exercises again because their shoulder's now healed. Whereas the same thing with you, where you're going to have, okay, I've overcame even if it's partially overcame my feelings of anxiety, but it's like, that wasn't, I'm here to show you what you're supposed to do. It's not that once your anxiety's gone that I'm no longer there and you're completely healed. But right. Like, for us, that's one of the big things that I have a problem with telling people, or making sure people understand, is like, listen, use me as a resource. You come to me once you start getting the groove and feel more confident. That's when it's more of a discharge, as opposed to, I feel 100% now. I don't need to go to PT anymore. I don't need to do those exercises.
Yeah. Again, like, you focus on the value of things and how much progress someone's made. That, at least, that I try and do, especially with the kids, because the kids that we see in home, we only see for 6 months. So again, we're trying to keep them out of the hospital, or, from being hospitalized again. Right. So, okay, we've kept you out of the hospital. These are the skills that you've learned to stay out of the hospital. And these are the things you're going to have to continue to do when we transfer you to a lower level of care. And they're going to continue to work on those things with you. So then it's also reinforcing that point to the parent, because a child isn't responsible for their own care, right? It's the parent's responsibility to bring them to care. So really trying to, nail that point in, when working, with those, higher intensity kids. But in outpatient, I think it's doing the same thing. You learned all of these things, just like in school, you're going to continue to utilize these things, in different settings, in different ways. And, that's kind of like what I've taught you, and you do them, probably without recognizing them. So it's just, when you can recognize them, it's just, again, being able to utilize them, use the skills that we've gone over so that you can continue to be, on the up and up. But then, if you don't, you can always, you can come back. We can do a booster session. You can come back, we can, evaluate and see, if you need more sessions than just like a once a month booster session type of thing, and just kind of see where we need to go from there.
I think for me, they come back to what is wellness, and like what does it mean to be healthy?
Yep.
It's not a single. It's not like you get to this point. And
it's not linear.
Right. Oh, once you reach this point, you're healthy. It's like it's that act of continuing to work on whatever you need to do, because it's nothing is ever complete. It's whatever it is, you have to keep working.
Yeah. And then I think just to come, full circle with COVID and kind of everything that we discussed, and, there's so many things going on for so many people. And it's just, how do people focus on wellness as a whole and that continuum, when there are so many things going on, right? Like I had for example, like I had a huge life transition that brought me back this way, that took me away from, the physical aspect of it, but then had me focus more on like the mental health part of my life and, work and all of those things. So it's just, being able to recognize as a provider, what is happening outside, for these people, that does keep them away from that. And then how do we try and fix that for them? Or how can we, connect them to people that can help, fix that, support that, help them work through that. So, because it does, it's so hard to keep it on that circle of, just that continuum of trying to be, the best, that you can be, I guess. Just sounds super corny.
I feel like people don't really see the value in taking care of your health and wellness every single day. It's like, damn, I really have to go and do these exercises, or I have to go and do this breathing shit. Well, I'm like, you will spend hours on TikTok or dumb TV shows and not realize like, oh, taking 10 minutes out of your day just to do simple things. Like, take 5 minutes out of your day to breathe and be thankful for what you have for today. Is like, I think as a society, we have a big problem in taking the time of what's actually important as opposed to what's easy and what's enjoyable.
That instant gratification type of thing is a huge issue.
Do you have like anything that you recommend, maybe your daily routine or anything that you would say is like, hey, if you do this, these are pretty good ways to start with your mental health?
I do. I've gotten a lot more into meditation. I like David G meditations on Spotify. It's just what I connected with through like the pandemic. And he kind of, I just like his, like there's certain guided meditations that I like to listen to for him that focus on, it was like forgiveness and like different things like that. So I really liked him. I do those like once a week. And then it's really just in the morning, just trying to reflect on 3 positive things that I really try and do that. So if that's with myself, if that's how I want my day to look, really anything, just trying to start my day off positive so that it can try and be a positive day. And not saying that it always ends up like that, just based off of the work that I do. But, if I can try and start off that way, then that's what it's going to be. So.
Solid. So thank you for coming on. One of the things that we usually like to ask, like, where can people find you? Or like, where can
so I have a hash, like an Instagram and Facebook set up for my private practice, which is under Marisa Musumeci, LPC. So I can send that to you guys if you want. So I mean, I post like different. I was posting a lot. I haven't posted in a while, but sometimes I post like a lot of different skills or things that people should try and utilize like day to day, or what things that parents can utilize like with their kids. So, or I repost from like different sources that I, you know, will refer to for my work. So I'll give that to you guys.
All right. Thank you for, I love having the conversation. Thank you.
Yeah, it was fun. Thanks for having me.
Of course.
Nice to see you guys.
I know. I hope you're doing